Aloha gang, Dr. Russ Rosen here. Welcome to the OHC System Masterclass. Again, Dr. Russ Rosen. I help natural health care providers like you thrive in a care versus care, true optimal health model. If you find value in this, please let other folks know about it so they can come into the free community. Also, if you want to dive deeper into this particular subject as well as all the other ones we do, just put club below and I'll get you free access into the club. We meet there on Thursdays at 11 o'clock California time for an entire hour. We do a Zoom call where we have a conversation and we dive into extreme detail in these particular subjects. So today, and I'm just going to go ahead and check and see if I'm showing up. Okay, so we've had challenges with you being able to ask me questions because it doesn't show up. So we're just gonna try, see what happens. So I'm gonna go ahead and I'm gonna type right here. I'm gonna type right here. Let me know if you are here. Oops. And if you have any questions as we go. Okay, and we'll just see if that shows up on the other page. There's like a 6-second delay, so sometimes that just doesn't show up for a while. Let's go ahead and check and see if it shows up now. Okay, good. It is showing up now. So if you happen to be there, go ahead and comment, let me know. Great. So what we're going to be doing is diving into the examination today. What I know is that we really want our patients to get what we do, want what we offer, so they happily stay, pay, and refer for a lifetime. And many of us spend like an hour doing an examination, and our patients really don't get it. They don't understand what happened. What we want to be able to do is spend the least amount of time and get the very best results, that we don't overwhelm them with information. So many of us just overwhelm people and then they start drooling and they don't come back. So we want to give them just enough information. We don't want them to drool. We want them to get this bigger picture so that they recognize they can get healthy, stay healthy, have the best life possible, not just feel better, but really get towards optimal health. Again, these kinds of things are in the club if you like. So I've mentioned before that I've had several people have told me if I can keep these around 10 minutes, more people will watch them. So I'm trying. I'm doing the best I can. My number one value is to underpromise and overdeliver, and that's where I get myself in trouble. So what I just want to cut to the chase in an examination. There are 3 very specific steps that need to happen in an examination. In the club, I'll be going into all 3 of those. Right now, I'm going to dive into one of those. Okay, it's something that I want you to do today. Just go try this today. So when I was in chiropractic school, I took a management course, and the management course, outside of chiropractic school, the guy said, when you do an examination, hit the record button, let them know I'm recording, so don't talk, because you don't want them talking. I disagreed with it back then, and I definitely disagree with it now. Now is the time to educate them. Now is the time to get it. You'll remember in the consultation, we draw their story out of them, and we apply our story to their story. If you didn't see it, go to the guide section in Masterclass, go to the doctor's consult. All right, so we're going to do the same thing in the examination. Now, I want you to write this down. This is specifically for chiropractors talking about subluxations. If you're a naturopath and you're talking about congested organs, if you're an acupuncturist talking about congested chi, I don't care what you're talking about, you just change the word subluxation. It'll work for you also. Okay, oftentimes if you have a subluxation causing blank, we'd expect to see blank. Is that going on with you? Well, that would make sense because blank. Okay, here we go. Oftentimes, if you have a subluxation causing blank, we'd expect to see blank. Is that going on with you? Well, that would make sense because. Okay, so in the examination, again, 3 things we have to do. The second one is our hands-on, okay? Let's assume someone has headaches. right there. I'm going to touch right there, yes. And now I'm going to start to palpate. And I'm going to say, oftentimes, if you have subluxation causing these kinds of headaches right here, we would expect to see a tender spot there. Is that tender there? Yes, it is. Well, that would make sense because this nerve literally goes to there. Now, in my world, we've got this brochure. It's a Merrick chart with some alterations in there that I found very valuable. And it says you have a back problem or a health problem. It's got the chiropractic premise and then the whole story on the back. And then this is motor sensory and autonomic. Motor sensory and autonomic. Again, if you want this, jump into the club, put club below. I'll give you a free month. You can go ahead and download this and dive into this deeper class that we're going to do where I go into extreme detail. But I just want you to feel this if you were a patient and you can start to do this. So it's interesting. You've got headaches right there. You know, it's interesting because oftentimes if you have a subluxation causing these kinds of headaches, we'd expect to see a tender spot there. Is that tender there? Yes. Boy, I think we might have found the underlying cause of your problem, and it would make sense because this nerve literally goes to there. New paragraph. And oftentimes, if you do have a subluxation causing these kinds of headaches, we might also see spaciness, dizziness, mood swings, brain fog, eyes, ears, nose, throat, sinus issues, ADD, ADHD, brain issues. Do you ever get any of those? I get sinus problems. Well, that would make sense because this nerve doesn't just go here, but it also affects all of this. Let me ask you a question. If this subluxation was causing your headaches and your sinus problems, and it got taken care of, what would happen to your headaches? Yeah, they get better. I'd agree, right? I'd agree. Drawing their story out, applying our story to their story, using the neuroscience of communications. What if it was also causing your sinus problems and we got it taken care of? Well, my sinuses would get better too? Well, of course, right? This is how we make the picture bigger for them, health, not just for symptom, chief complaint. What if it is causing your headaches, but it's not causing your sinus problems? And we get it taken care of, what would happen? Get better? Sure. What about this? Wouldn't affect it at all. I'd agree. Let's do some more tests. So I'm going to have them have this on a clipboard with a pen, and they're going to circle headaches. Circle C1 on the right. Underline sinus problems. Now move down, right? Maybe to T4, T5, because that's what's going on. Do you ever get any discomfort in between the shoulder blades? Yes. It makes sense. Body compensates. Subluxation, subluxation. You can feel that. Yes. Do you ever get any pain in the mid-back area, radiating pain around the rib? Yes. That would make sense. This nerve goes to there. Do you ever get any gas, bloating, indigestion, heartburn? I'm not going to say digestive problems. People don't know what it means. Gas, bloating, indigestion, heartburn. I get heartburn all the time. Can you underline that for me? Well, that would make sense because, right? Because this nerve goes to there. So we want to connect these dots, but just start to use that phrase. Oftentimes, if you have a subluxation causing blank, we'd expect to see blank, and that would make sense because blank. Then I'm going to connect it to motor, sensory, and autonomic. Then I'm going to start to prove my case. And if you did have this going on, which clearly you do, we might see a limited range of motion. Do me a favor, turn your head to the left, turn your head to the right. Wow, do you see it doesn't want to go to the right? That would make sense because when you're subluxated, the nerve interference causes your muscles to pull on your bones to protect the area so it feels stuck in tight, right? Protecting your cord. Does it feel stuck in tight? Yes, then you must be what? I must be subluxated. I'm drawing their story out. I'm applying my story to their story. Drops into their limbic system as a new belief system. So I can look at motor sensory autonomic. I can look at their lifestyle, right? How they eat, whether they're getting good movement, exercise, stress, that type of thing. I can find that. Wow, do you feel how tight these are? Do you find yourself getting stressed? Talk about stress, right? Diet, mid-back, gas, bloating, indigestion, heartburn, diet. So you can connect all these dots for people. And it doesn't matter what technique you use. It doesn't matter if you're using chiropractic, your naturopathy, acupuncture, osteopathy. It doesn't matter. That phrase works. You just got to use the right word. Lesion, congestion of energy, whatever it is. And then we can also start to talk about their 3 dimensions of stress, like what got them in this shape: mental, emotional stress, biochemical stress, physical stress. We already talked about those in the consultation. We just start to point those out, right? And we just keep using that phrase over and over and over again. Oftentimes, if you do have that, we would expect. And then at the end, I'm just going to walk them through this whole story at the end. I'm going to say, where are your subluxations? Well, they just circled them. What could they be causing? Well, headaches, sinus problems, mid-back pain, indigestion. What probably brought them on? Might crack cocaine use. What if you don't get them taken care of? Probably get worse. I'd agree. And if you do, feel better, prevent problems, reverse the effects of the aging process, or be healthier in 5 years than you are right now and have a better life. Right? If all I did was help you feel better, but you didn't have a better life, that would have failed you. Right? I'm planting seeds for the difference between feel better and actually resolve your problems, get healthy and stay healthy and have the best life possible. So at the end, I'm just going to ask him, you tell me, headaches, sinus problems, mid-back, indigestion, coated tongue, stinky armpits, explosive diarrhea. Just a back problem or an overall health problem? What do you think? Just a symptom or an overall health problem? Just this or a brain problem? Just depending upon how you practice. So that's something I just want you to start to play with, right? You're already doing some form of this. Just oftentimes, if you have a blank, like subluxation causing blank, we'd expect to see blank, and that would make sense because blank. Where we blow it is we don't talk about that would make sense, so they don't get it, right? They're like, I have lint in my belly button causing my headaches. What? This is causing headaches. This could be affecting my sugar handling, right? You got to connect the dots for them. Okay, with that said, I am going to, okay, Roxanne, no questions at this time. Roxanne, my Corvette that I just sold was named Roxanne, so good to see you there. Habib, hello from Toronto, Canada. Welcome aboard. So, thank you for letting me know you're here. If you want to dive into the club on Thursday, or at least get that recording, you can get that. And we're going to go into an hour discussion on this one piece of how you can fully integrate that into your practice, regardless of how you practice. So to be conversation, if you're doing nutrition or whatever it is, you're just going to let me know. I'm going to help you figure that out. Okay. So I'm going to check one more time if there's anybody else that might have questions. And if not, we're going to see if I could keep this one at least under 15 minutes. Tom Lankering, do patients take the brochure home with them? Yes. Great question. You're going to make a copy. They're going to take it home, right? And we're going to say, by now you get it's a health problem, not a back problem. Who do you know who might benefit, right? Would you like to take ones home with your family? We have ones for adults, children, and infants. So yes, we absolutely do. But you got to make a copy for your file. Good. And then Tom, you and I will be talking more about that tomorrow. I'll hit this one more time. Any other questions before we head out? Let's see. Nope. Okay, so you want to get in the club, go ahead and put club below. You have any questions, let me know. I'll revisit this and then I'll answer any questions that I possibly can. So if you're watching this on the recording, I'll go in and I'll type out any questions. And if you know other folks, please let them know about this. Really trying to get the word out. As always, much love and aloha. Bye, gang.